you mentioned natural hedge for the currency exposure. Can you comment on that?
Yes, sure. The company has a significant exposure in dollars, euro, and USD, as most of the costs incurred in Hungarian forints. So an investor investing into buying Richter should consider a long position in ruble, euro, and USD, and a short position in forints. As for the natural hedge positions, Richter also has a euro debt, and currently Richter is setting up a plant in Russia, which also causes costs in ruble. So basically, to conclude, around 25% of all the currency exposure is mitigated by natural hedge.
Thank you. Do you have a breakdown of revenues in terms of the patented and the non-patented products?
As far as the two products, Esme and Cariprazine, are concerned, we can state that EMEA, for the end of 2020, will be responsible for the 13% of sales, while Cariprazine will mean 3% of sales. The other ones, these will be covered with patent.
But currently speaking, as of today, what's the percentage of revenue coming from their patented products?
Richter has two major patented drugs, Kevintone and Midoton. These two account for around 7% of all the sales.
At the moment?
At the moment,
okay.
Right now.
And do you know how long it took them to develop these products? How long did it take them?
Usually, an original drug to develop, it takes 10 to 12 years. Of course, Kevintone was developed in the 80s, so it's quite an old drug for Richter. It took approximately 10 years to develop, and also Esme and Cariprazine is now in the latest stages, and it took approximately 8 to 10 years to reach this kind of stage.
Thank you.
Excuse me, also adding to this, Richter's expansion strategy into original drugs is also driven by acquiring companies with late-stage projects. This is also one of the way how they acquired Esme.
Could you please go back to slide 17 and explain us how you arrived to the valuation based on multiples, and how you, use the R&D potential to arrive to that valuation?
Yes, we use the EV per EBITDA multiple to value the company from a relative valuation point of view, because this is a best practice valuing pharmaceutical companies, and we thought that our would be the best approach to use the same metrics as the market. So we used the EV per EBITDA multiples. We created a peer group based on the Richter's main geographic segments, and we weighted their multiples and we valued the company.
Also adding to this, to the R&D correction. So as we took the peer group, those companies that are usually compared to Richter by the market have, well, not significantly, but some percentage points lower R&D expenditures than Richter does. And correcting for these, we added it back to the EBITDA, and this is how we came to this conclusion.
Usually, a company is either a generic producer or a specialist. Yes. Why do you think, in this case, management will manage to be successful doing both at the same time?
There are some historical stories behind Richter where they managed to be a generic company and at the same time develop original drugs. as my colleague mentioned, the company has currently 2 patented drugs, Corvinus and Midaton. So first of all, yes, they do have the know-how to manage these 2 segments. At the same time, the company also has a very strong cash base from which they are able to finance both types of operations. So yes, it's based on historicals.
Okay, for the EMEA product, when did they apply for the FDA approval? And how long does it take?
They applied to in 2010, and the normal process is long, as my colleague already mentioned. But ESMEA's process was faster than they expected, and that's the case also with the 2-phase extension. So ESMEA is already in the markets in Europe, and that's the flagship for the expansion in Latin America. So ESMEA, the second phase ESMEA is now in phase 3, and they expect it to be launched in 2015, but there are so good signs that maybe it will be launched earlier than they expected.
In the US, you mean?
And in the US, it's also in phase 3.
Yeah, that's my question. When do you expect it to be sellable in the US?
In 2015.
Okay. So they applied in 2010 for FDA approval, and they're expecting the approval in 2015?
Well, actually, the drug is already introduced in the market for a basic, well, pre-operational cure, pre-surgery cure of uterine myoma. This extension that is currently in front of the FDA is only for the use of the drug that can possibly avoid surgery. So, yes, concluding, the drug was already in the market for the last couple of years, okay, and they applied for this extension in 2010.
Okay.
Is the stock part of any indexes, geographic or sectorial?
Yes, this stock is included in the MSCI index. Actually, it was excluded in 2012 November because the very low liquidity, daily trading volume. But then a company performed a stock split, and the liquidity increased as much as it was included again in the index last year, December.
And besides, it's also part of the books, the Hungarian Stock Exchange Index. And in this slide, you can see its performance compared to books and the other indexes, for example, the FTSE Eurofirst 3000 Pharma Index.
I noticed they're not selling anything in Canada. There is no revenue generation from Canada. Is this because they were rejected or approvals to sell there, or?
Well, Canada is a very special place for Richter to operate because there are some products by Richter, including also EMEA, but they are distributed by Actavis. So Richter has a distribution agreement where they hold the license and the rights to the drugs, but Actavis is distributing them. So this is why there are no direct sales from Canada.
Could we go back to the Russian market for a while? Apart from the currency risk that we know, is there any market risk, and particularly any regulatory risk that we should be aware of? How does the healthcare system in Russia works, and is it supportive for their growth expectations?
In Russia, in a couple of years ago, the Pharma 2020 regulation was introduced. This influenced Richter, as all of the pharma companies in Russia. This is a very strict regulation, as it requires all the companies to product the medicine in the country, so in Russia, instead of exporting it. In order to comply with this, Richter has decided to set up a plant in Russia, and this is currently in process. the plant is going to be ready in 2015.